So, a very happy Diwali to all of you.
Happy Diwali.
So, today we are going to discuss a case, and when we are discussing a case on the special occasion of Diwali, which is called the festivity of lights and diyas and happiness and spark, we are here to present you a very interesting case. To start with, maybe it was not very interesting because the patient suffered a lot for many years and nobody was ready to help her. And I hope this Diwali we brought a little spark, a little happiness in her life.
We sure did, ma'am. Hopefully.
Okay.
uh,
So, and this is one message which is for all of us that as doctors, as gynecologists, as urogynecologists, we have so much in our hands which other people can give happiness and spread happiness with money, with good deeds, and many things. But maybe we are the only people, we are the only people whom God has given this gift where we can bring a change by taking away their agony, taking away their misery, and especially when it comes to urogynecology. In today's world, maybe the things will change a decade later or 2 decades later, but today the women are really suffering and they really need help. And all our stories, when you listen to them, you will realize that how much each and every one of them has suffered over the years.
yes, ma'am. Maybe with time, like they'll also seek timely help.
Yes,
Yeah.
yes. So let's see how much happiness, how much spark we are able to bring to this lady's
Yes,
life,
ma'am.
who is just 37 years old. So,
So,
Dr. Suvrati, you know her. She'll be presenting the case, and I'll be ragging her by asking questions.
okay, good morning. Happy Diwali, everyone. So, here my case goes. I'm here to present the history of Miss X. She's all of 37 years old, para 2 living 2. She had come with the primary complaint of a mass per vaginum. And over these years, I'll be telling her detailed history and the whole sequence of events, but right now I'll describe her complaint. So, over the years, her mass per vaginum has increased over time. Initially, when she would, at the end of the day, it would increase, ma'am. But now it has become that it is constantly out. And she is able to reposit it, but it comes out on its own. That problem is there. And
So we are discussing today a case of mass per vagina
Mass per
in a
vagina.
37-year-old lady.
yes, yes, ma'am. And our diagnosis becomes clearer once I tell the sequence of events in her life. But right now, her complaint is having a mass per vaginum, which has constantly increased over the past couple of years. And earlier, she would see that progressively, as she went about her day, it would increase. But now, it is always out. And she is able to reposit it. It doesn't go back on its own. She has to manually reposit it, but then it comes back. She has no complaints of any bleeding per vaginum. She has no urinary complaints, no features suggestive of any incontinence of any kind, no bowel related complaints, no backache. And she doesn't give any history of any wound or ulcer on the mass either, ma'am. And now, should I tell about her sequence of events?
Yes.
Huh.
You tell, but because she is a young patient,
Yes,
I
yes.
would also,
Also,
like,
ma'am, no sexual complaints as of now. Like, I mean,
she's able
to
have
have intercourse comfortably. Yes, yes, yes.
she's having normal sexual life.
Normal
That's
sexual
what she
life,
feels.
yes. So with her, what happened? So she's para 2 living 2. Her first delivery was a normal vagina, not a normal vaginal delivery. It was a forceps vaginal delivery. And at that time also she gives history that she had a prolonged labor, ma'am, for almost 1 day.
That was how many years ago?
So this is, ma'am, almost 15 years ago.
Okay.
Yeah. Then she underwent forceps vaginal delivery. Post delivery, ma'am, she doesn't give any history of any kind of incontinence. But one specific thing that she said was that she didn't have any help around the house. So at her time of discharge, which was on the 3rd day, she resumed everything at home. She resumed all her work, taking care of the baby, lifting everything. She did all of that right from day 3. And after that, so what happened was progressively over the years again, by the end of the year, she said that she started feeling this mass per vaginum again. But she couldn't see anything coming out. She just had a feeling of heaviness. And she got pregnant again. This is around 12 years back.
So within 5 years.
Within, like 2 years, ma'am. 15 years,
okay.
and within 2 years, she was pregnant again. So after she was pregnant again, during the course of the pregnancy, there was a mass. Her history that she gives is that there was a mass per vaginum which progressed, and as her pregnancy progressed, it was out of her vagina. So she underwent cesarean in view of this mostly prolapse, is what she says. After this surgery, after she underwent the surgery, again, she did not have any features of incontinence, but her feeling of heaviness and prolapse, this persisted. So again, about 2 years after her cesarean, she underwent a vaginal hysterectomy with pelvic floor repair. She underwent both of these things in another hospital outside, and this happened around 10 to 11 years ago. She underwent this surgery.
So, and she was not even 30 that
No,
time.
ma'am, she wasn't.
At 28,
26 or 28, yes,
years old when she was.
She had already undergone so much.
Vaginal hysterectomy,
Yes, ma'am.
pelvic floor repair. Okay.
Yeah, and after now this pelvic floor repair was done, she said that within a month after that, she again felt that there was a mass per vaginum, and by the end of that year in which she underwent surgery, again it was outside of her vagina. And now for the past 5 to 6 years, but that time she had those typical complaints, ma'am, where she said that during the course of the day her mass would increase, when she would lie down her mass would decrease, and all those things. But over the past 5 to 6 years, she has had a complaint of a mass which is constantly protruded out of her vagina. And this has increased over the past 5 to 6 years, and she has sought help over these 5 to 6 years as well, but nothing was done. And now she was referred to us around 2-3 months ago, and we decided on the surgery and everything. So she came and she had a grade 4 like vault prolapse.
Yeah, so it is a very clear-cut case.
Very clear-cut case.
Very
Yes,
clear-cut case. Pelvic, she was young.
Literally everything that could go wrong has gone wrong.
Yes. And age of pregnancy, first pregnancy
Would
was
be, ma'am, around 22.
22.
Yeah.
Young age she became pregnant. It was a difficult delivery.
Difficult delivery.
Forceps delivery, which
Yes.
would have caused some pelvic floor
Yes,
trauma.
yes, yes.
And she started having symptoms of, she resumed her work very soon.
fast, ma'am, yes.
Very soon.
She
So
had
there
no
was-
help, according to her.
Yeah. So there was not enough
Mhm.
time for
For
her
rest,
pelvic
repair.
floor to
Hmm.
have some rest.
Hmm.
And
And she was not aware, ma'am, of any exercises,
Yeah.
physiotherapy. She has not practiced any of that.
So then very soon she became pregnant
again.
again.
Yes, yes.
Okay. And her symptoms increased because
During
of that
pregnancy,
during
yes, ma'am.
pregnancy, because of the
That
heaviness
bulge,
there,
yes, yes, ma'am.
okay, of the baby pushing the uterus further down when the
And even the
ligaments and
congestion,
support is
ma'am, you
not
told me that would
Yes.
have, yes, ma'am.
And so cervix comes out, uterus remains up. So it is difficult to try vaginal delivery in these cases
Yes.
because cervix will not dilate. Okay, it is congested all the time outside. There is no place for cervix to dilate. Okay, so I don't know whether they have tried or not tried.
Ma'am,
but
even
many-
no, she said that she underwent a cesarean.
Elective,
Yes, ma'am.
Right.
Ma'am, does the cervix come out? Like she said, the cervix was out, like not cervix, but she said the mass
Mass was
during pregnancy itself. By the time she was term, it was a term cesarean, ma'am.
Yes.
It was outside of her vagina.
Yes. It is.
Oh.
I have seen many cases.
Okay.
I will not say many, but a few cases like that.
Where it is outside.
Where it is outside.
Okay,
In
okay.
pregnancy with prolapse,
Yes,
we
ma'am.
don't see it.
Huh.
First case I saw when I was a PG.
Oh.
I think during my PG time only I saw 2 cases of pregnancy with prolapse.
Yeah, because we didn't see any, ma'am.
Yes,
Yeah.
maybe it was your first.
Yeah,
like,
definitely. Like in the
history
history,
like that,
yes, ma'am,
yes.
definitely. That's why I kept asking her that what do you mean prolapse ke liye you underwent cesarean? I didn't understand that
Yes.
until I asked you, and I was like, ma'am, she's saying that, but shouldn't the prolapse have gone up?
When the uterus grows in size, even the cervix becomes bulkier
Yes, ma'am.
and increases. There is hypertrophy of cervix also. And because of this hypertrophy, this congestion, pelvic floor being loose, and because of increased intra-abdominal pressure, because of the growing fetus, placenta, amniotic fluid, it tends to come out. And usually cervix in those cases, full uterus cannot be
Yes,
out,
yes,
but
ma'am.
cervix will be hanging out of the introitus in these women during
Okay.
pregnancy.
This is probably this is what
This
she
is,
had.
yeah.
Ma'am, does it cause elongation also?
It can cause elongation also, but I think one concept which is very crucial, I would like to explain
Yes,
here.
ma'am.
So usually the length of the cervix is 2.5 centimeter. Okay,
Yeah.
and in pregnancy, the cervical length, I say in normal size of uterus. Okay, I'll tell this if the beginners don't know this. I have a small idea of how to always remember the dimensions. So the size of uterus is 1 into 2 into 3 inches.
Yes,
I
ma'am.
always tell.
Yes, ma'am.
So that means 7.5 centimeters into 5 centimeters into 2.5 centimeters. Size of normal ovary is 1 into 2 into
Yeah.
3 centimeters.
Yes.
Inches and
Centimeters.
centimeters here. And the fallopian tubes are 10 centimeter long.
Yeah.
Vagina almost is 7, 8, 9. Interior wall 7.
Okay.
Cavity is because its shape is like 8, so we call it 8. And posterior vaginal wall is 9 centimeter. Cervix in a non-pregnant normal uterus, cervix is 1 inch long, 2.5 centimeter.
Okay.
But you would agree with me, in pregnancy we say that if cervix is less than 2.5 centimeter, it is
It's
a
short
cutoff, it is
cervix.
short cervix.
Yes, ma'am.
So why this change? Why this discrepancy in our measurements? Because in pregnancy, when the uterus grows in size, cervix is also part of the uterus.
Yes,
that
ma'am.
also grows in size. So the cervix, normal cervix in pregnancy becomes around 4 centimeters. And the cutoff of short cervix is like
2.5.
what is normal in
Physiological
non-pregnant,
cervix. Yes, ma'am.
2.5 centimeters.
Yes, ma'am.
Okay.
Yes, ma'am.
So when the cervix was 2.5, it was staying there.
Right.
Okay, maybe there was cervical elongation. Now, one of the reasons you very correctly said that there can be cervical elongation because though nobody knows, nobody has researched enough to find out what is the cause of cervical elongation. But there are theories, there are hypotheses that if pelvic floor is weak and something is gravity wants the uterus and everything to come down, it is pulling from down, and something is holding the uterus up, like fibroid,
Or in
like
this case, the
adhesions.
baby.
In this case, the baby
Yeah.
is holding it back, cervix will get elongated. So you are very correctly in your thinking and your hypothesis that maybe the cervix that time underwent
Even
lot
more
of
elongation.
Okay, so this is a clear-cut history. So that time patient underwent after a few years.
Cesarean. Yes, ma'am. After cesarean, she underwent VH.
VH in 2 to 3 years.
2 to 3 years later. Yes, ma'am.
Vaginal hysterectomy and repair. Now my question to you is, Suvrati, if the same patient when she is 27, 28 years old would have come to you
Yes, ma'am. Post her cesarean.
post her cesarean, post everything, now she has come with, not post, with the mass protruding outside,
Okay.
with prolapse, when she is 26, 27 years old, what you would have done to relieve her symptoms?
Yes, ma'am. So, in this case, for her, I would have done a suspension, ma'am.
Very good. First, we would have tried pelvic floor muscle training.
Yes, definitely. If she would have come to us more timely, yes, ma'am. Yes.
And maybe pessary?
Pessary, yes.
Yes. So pessary is good. Sometimes for elongated cervix, it might not help.
Yeah.
But what surgery? If you thought that no, nothing else is helping, she requires a surgical management. Would you have gone and done a vaginal hysterectomy?
No, ma'am.
So what would you have done?
Ma'am, I would have done a sacrocolpopexy.
Sacrohysteropexy.
Yes.
Sacrohysteropexy would have been one very good treatment.
Yes, ma'am.
What other treatment would have been the for-the-gill surgery?
For-the-gill surgery, yes, ma'am.
Elongated cervix, you amputate the cervix and you tie these ligaments. In elongated cervix, in cases where the cervix has undergone elongation, if you do sacrohysteropexy also, amputation of cervix can be one part of it.
Okay, ma'am.
So we could have done some kind of conservative management for her.
And save the uterus,
Yes. Now, as you said, save the uterus. Save the uterus is very, very important. I have seen many doctors saying this, that now childbearing is over. Now what is the use of uterus?
Yeah, family is complete.
Family is complete. Uterus can be removed.
Yeah.
And if you tell them more that you will get menopause or any other symptoms, they say, no, I am leaving the ovaries inside. This patient also, there was one ovary left. But that is not enough. So what are the consequences if somebody undergoes a hysterectomy at early age? Consequences of hysterectomy at an early age.
Ma'am, firstly, it is like a surgical menopause.
Yes.
And that actually has a very, psychologically, a very bad impact. So that would be one.
Okay, surgical menopause. And that
psychological
impact. What other factors?
The chances of wall prolapse.
Chances of wall prolapse, very good.
What else?
Then sexual problems also can happen because till the time, though there is no evidence that 100% supports this theory
Okay.
that there is sexual issues when once you remove the cervix out of the vagina. But yes, there are evidences here and there which say that sexual activity is much better if the cervix is intact.
Is in place.
Okay.
Yes.
Then, but you have to understand one thing: it is not just surgical menopause. What happens when you remove, when you retain the ovaries also, and this is evidence, okay, and you remove the uterus alone, within 5 years the ovaries
Will
feel
also go in
that
failure.
there is no target organ, there is negative feedback,
Yes,
and they go into failure. So the patient will have menopause, actual menopause, when ovaries stop functioning within 5 years.
Okay. So not
So
just
27, you have removed her ovaries. That means within 4 to 5 years, by the time she is 32,
uterus.
If you have removed the uterus, by the
time
time
not
she is
having ovaries also maybe
also
5
within
years
4
later.
to 5 years. Okay. So she will get all kinds of problems: osteoporosis, Alzheimer's, then heart-related problems. All problems which you see after the age of 50, 60 years, patient will start having
will occur
now.
very prematurely.
Yes. So there are so many bad effects. It's not just removing the uterus.
Yeah.
Removing the uterus, I always tell the patient, is half an hour job for us. But you think of your long-term consequences, because sometimes patients start fighting. Patients say that I want hysterectomy, I am fed up with my problem. But you have to educate them.
Yes,
you have to counsel them about consequences, and you have to tell that you have options, better options to retain the uterus and still take care of your disease, their disease. So this is very important. So if she would have come in modern day, maybe 27, 28, we would never have suggested her to undergo hysterectomy. But you don't know, maybe somebody tried to help her with whatever skills and whatever knowledge that person had.
At that
We
time,
don't know.
This is more than a decade ago.
Yes. The important thing here is that now the patient has come to us with her problem and how best we can manage her problem. So to summarize again, I'll tell you, she is a young 37-year-old Paris lady who had present to us with history. It looks like a huge vault prolapse. Patient is, remember that patient is sexually active.
Yes.
Okay. Now with this, we go ahead with the examination.
Yes, ma'am. So coming to the examination of this lady, her general condition was fair, ma'am. She was moderately built and nourished. Systemic examination was normal. On her per abdomen examination, it was soft, non-tender. There was no mass palpable. There was a small umbilical hernia, 1 by 2 centimeters.
Very good. I'm impressed that you have looked into it.
Okay. And along the incision also, there was no incisional hernia. But coming to the local examination of the mass, so this was a 9 by 10 centimeters mass coming out of the vagina. It was pale pink in appearance. There was no ulcer or no wound noted onto the mass. There was no bleeding. And cough impulse was present. And the vaginal rugae were prominent. They were seen on top of it. And the vault line was very clearly seen more onto the anterior side. There were both cystocele and enterocele. Both defects were there. And other than that, should I say anything else, ma'am?
You have to tell me PubQ.
Yes, PubQ.
Okay, before that, when you guys examined this patient, patient was already admitted.
Yeah.
And for 1 day, she was like, she got admitted 1 day prior.
Yes.
And next morning, this examination was performed.
Yes,
Am I right?
Yes, ma'am.
So you are saying still the mass was huge, around 10 into 10 centimeter and 10 into.
Yes, ma'am.
But when the patient came to me for the first time, around a month ago, she has, see, that's what is all about prolapse.
Okay.
So she has traveled from somewhere, sat on the OPD, gone from this side for her registration. She was walking. She was ambulatory.
It was even more?
Time. It was when I just lifted her tray to see the mass. It was like a watermelon size. It was all. It was, even this is huge, but when she came, it was like a football size mass which was hanging. Because the mass increases, there is no support. With walking, that day she was active. So that would have been her condition in a day-to-day basis.
Yes, definitely.
What we saw
was after she was probably well rested and all of that. Oh God.
Yes. So it was a very, very big mass, and patient was at the verge of crying that day when I was examining her. She was so
upset.
and upset, and Maybe she was having little embarrassment. Okay, so it was a huge mass that day. Okay.
Yes, yes, ma'am. Okay, but when we saw it was this much only. It was 10 by 10.
But this
and
is explainable. This
Yeah.
itself tells that it was
Yes,
prolapse.
definitely. Yes, ma'am. But now it can increase that much. Like, oh,
Because there is nothing.
yeah.
All intestine when you start walking, more
Okay.
so in a case of all prolapse.
Yes.
This much change you will not see in a case of
UV
uterine
prolapse, yes, ma'am.
okay, but this much changes
Because there is literally no support. Nothing is stopping
no
it.
support. This is just a bag.
And as
keep
you're
on
walking, more and more things are falling inside.
Yes.
My God. So no, this was when we had examined ma'am, maybe because she was well rested and all of that. It was 10 by 10. PopQ was stage 4 because everything was outside.
Yes.
Anything else I should include?
So you have done PopQ.
Yeah.
Anything significant? See, the thing is, what I wanted to focus in this case is, usually you say stage 4,
Yeah.
okay?
Yes, ma'am.
Stage 4 prolapse or whatever, grade 4, whatever, then you know that everything is out.
Yeah.
Now, when you did her PopQ,
Yes, ma'am.
there were some very important features we noticed, which we might have missed if we would not have done PopQ. Okay.
Okay.
There are some parameters which we measure before measuring the A point and B point when we measure. Before that, we do some 2 measurements.
Ma'am, genital hiatus and perineal body.
What was the size of genital hiatus?
Her genital hiatus ka size, ma'am, it was around
9
7 to 8 I was going to say, but
it
9.
It was exactly when we
measured. Yes, ma'am. 9
it was 9 centimeters. So 9 centimeter genital hiatus is very, very big. And her perineum was just 1.5 centimeters.
Yes, yes, ma'am.
Okay. This information we could have missed.
Had we not done the PopQ.
Yes. Yeah. Why it was important? It was important for her management point of view. She is a sexually active, young, sexually active, that should run in your mind all the time when you are managing her. You cannot leave a 9 centimeter genital hiatus and 1.5 centimeters. And if, I don't know what management you have done, you will be doing. But if you have to do, usually if you are doing vaginal, then you will see this will be in front of your eyes. You will know that you have to repair.
Yes,
but if you are choosing to do an abdominal procedure, there is chance that you might miss that.
Yeah.
As soon as you close the abdomen,
ma'am, you saw the measurement, and I remember you clearly said that we have to do a perineal.
You remind me.
Yes, I remember that.
Yeah. Because sometimes when you are, lot of cases are posted in OT and you are running short of time, then
and you know you have to change the approach completely.
And this thing doesn't, because some other person will be standing or sitting at the vaginal.
Yes, ma'am.
This is very likely. You see that everything looks fine, and you go. So all these notes you have to make before surgery. Yeah, and you have to remember that she will require a perineorrhaphy, also good perineorrhaphy.
Absolutely.
So this was an important thing which you would have learned, why we must do a PopQ examination in day-to-day practice also. If you are not making the grid also, at least have a look the way PopQ looks at it.
At least the important points.
Yes.
Yes, ma'am.
Okay.
But ma'am, I feel you should really take more and more PopQ lectures. I still need them.
So honestly. You remember the first case I did?
Yes, and I said the same thing. And after 2 years also, I'm saying this only, ma'am, no PopQ.
No, but immediately after that, I kept my promise. You left the place, I kept my promise. Yes, I did a lecture. And I think it is a very interesting. I have got
ma'am,
many
you've done all examinations, and somehow when I see it, it looks really simple. But I still feel that PopQ is something you have to perform it. And you have to perform it.
Yes.
Yeah, absolutely. Yeah.
Okay, so we'll do more
cases
of PopQ, and if our viewers also feel the same, you are free to post a comment below. If you also want us to do some PopQs for you and post it in the channel,
different cases like while performing, I think it will really help everybody.
Okay, we'll do it. Okay. So I think we have already taken quite some time and given so much of information.
Yeah.
Why don't we do the management part discussion as part 2 of this case?
Yes, ma'am, absolutely.
Okay. So keep watching us. We'll come soon and show you how we manage, what our thought process was, and what surgery we performed for her, and how is her today. She is post-operative day 3.
Day 4.
Day 4. Yeah. So we'll discuss how she is doing. So wait for it.